All right, folks, I've got 4 o'clock. We'll start off with the Pledge of Allegiance, please.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, welcome everybody. Glad you're here. It's got a lot of stuff to go through today, so we'll get at this. We have some things on the agenda, but not everything is on the agenda, so we will move things in and out as quickly as we can. We'll take care of general business first, and then we'll move into the new business. So, we have 2 sets of minutes to approve.
And if you guys have looked at them and happy with them, I make a motion, we approve the minutes for October 3rd and October 18th.
And I'll second that.
Moving second to approve minutes for October 3rd and October 18th. All in favor, say aye.
Aye.
Opposed? Okay.
That's it. It's payroll. There's 3 payrolls.
All right.
Well, there's 2. If you combine one payroll, or 2 payrolls together for the total.
All right.
All right, next we have payrolls to approve. We have 2 payrolls to approve. One in the amount of $181,571.76, and one in the amount of $207,335.22.
We go to sign. That last one is actually a combination of 2 different
Okay.
payroll because she has the election numbers
Yes.
on a different
Yeah.
form.
Yes.
So we should have 3 to sign, Megan, when
Yeah.
Nicole gets it to you.
All right. Is there any questions on those? There's a motion to approve.
Yes. I make a motion, we approve payroll in the amount of $207,335.22, and also the one in the amount of $181,571.76.
And I'll second that.
All in favor, say aye.
Right.
Okay. And that,
Top 2 are the 2
yeah,
that's combined.
that 1,000 one there, yep.
Yep.
Yep. Thanks, sir. Okay. All right, then we need to approve acknowledge receipt of payroll claims accounts payable report in the amount of $178,804.27.
I make a motion, we acknowledge and receive the payroll claims in the amount of $178,804.27.
I'll second that.
All in favor, say aye.
Aye.
Okay. Then we have claims to approve, and they're hefty, but we have some extras on here now with election board stuff, Cover Bridge Festival stuff.
And it's not on the payroll. Or the account payable.
Amount of $527,781.15.
Make a motion, we approve claims in the amount of $527,781.15.
And I'll second that.
All in favor, say aye. Okay. All right, Chris, up for a grant request here. Just so everybody knows, got so many people here, just make sure you understand. Anyone for the county that's seeking to grant, just the state requires that it comes through the commissioners for approval. It's not a matter of approving or disapproving their ability or request to get a grant. It's just to make sure that there are no grants out there competing against each other from Okra or some other place. So that's why Chris comes and brings these grants before us. So what you got?
This is a grant with the Indiana Criminal Justice Institute to upgrade the computers in police vehicles. It's for a little less than $100,000. There's no match to this grant, and it will be done over next year.
Anybody got any questions on that? I'll make the motion when you approve the grant request as requested by the Emergency Management Director.
I'll second that.
All in favor, say aye.
Aye.
Okay.
And then just on some good news and bad news with grants is that we've been awarded two. One was for communications upgraded equipment in the dispatch for $20,000, and the other one was the normal salary reimbursement grant. But we were denied the dispatch console grant, which was the big one for $150,000.
Is there a chance later on go back for that again, or is that?
I don't think so. I'm trying to figure out why they told us no.
Okay.
But there's other paths that we'll look at later.
Okay.
Thank you.
Thanks.
Good evening.
All right, Exalt contract.
Good afternoon, gentlemen. I believe most of you are aware that we currently, within the auditor's office, treasurer's office, and assessor's office, use Manatron, which is sold a few times. It's Aumentum now, which is owned by Harris. However, there are only a handful of counties that use them currently, and we have no support. And my bill for support for next year is basically $20,000, and I get no support.
Might be able to save you some time on this. I
Okay.
think that we've met on that, and we are familiar with that.
Okay, so you don't need any.
We had the discussion during the meeting on the ARC funds.
Okay.
And so we are aware of what that grant was for. We reached an agreement with the council on how we would support their approving that. So I think we're well aware of what it is, and I think we are good to go. So if you've got
Are
a
you-
contract, we are good to go. If
You're
Nick's
good to
okay
sign
with
it?
If Nick's
I'll
okay with
just
it.
give you, yeah, I already sent it to Nick so he could review. There's the signature page, and I'm the attestation to it.
What
so-
this is, she could explain to you, lengthy time, Kim, too. We're just antiquated, of course, in the systems that we have. Our offices cannot speak to each other. The computers can't speak to each other. It's just, it's been that way for who knows how many years, and it's time to make a change. It's a pricey change, but actually, we will save money on the annual maintenance as it goes on. Not much, but some money on that. So this is a move of $300 and some thousand, I think, for the changeover, because there's so much time to move over so much data that you have to do. So hopefully this will get us back where we need to be.
And just for the audience, is so we have support if there's an issue, and we're usually in a time crunch with the state, then we will have support to help us get through those issues.
They expect that the company Worth now will be out of this business within the next 5 years, probably not do this anymore at all. They're going to stop supporting what there is. And if we wait until that support ran out to get in line, then with Exoft, it could be a couple years where we had nothing to operate, no support for anything that we were doing. Okay. And there's a line for you to sign there too, you know that, right? Okay.
Correct. And I'll do that, and I will send this all to Mr. Booker Wednesday, when we're back in the office. And then I have to upload it to the DLGF, who shares it with the SBOA.
When should the process begin, make the changeover?
Changeover for the treasurer and the auditor's office will be in mid-February. My office, we're going to wait till we roll and balance so the books are clean and at a cutoff point, and then we're moving over.
Okay.
So that'll be March-ish.
How much of the old data has to be dealt with as far as moving that? Any of it have to?
Everything has
That's
to be
what I
moved.
thought it did.
Everything has to be mapped. That's why it's such a pricey thing, because maybe numbers and that kind of text stuff is not a big deal, but the sketches on the assessor side for all the buildings is a big deal, and it's very pricey to move
Okay.
all those sketches.
All right.
Thank you, gentlemen.
Yep.
Thank
That's good.
Well requested. I know you were timid about requesting because of the cost, but you know, it's cost of doing business. If we're gonna serve the taxpayers the way they need to be served, we just need to do what needs to be done, so there we are.
Thank you.
Yep. Okay, we're gonna go from that to something not on the agenda, but it was arranged. So you guys come on up if you want to. And this is Nick Napier. He's with Sutton and Associates, who are with Brown & Brown Insurance, our healthcare carriers. And Nick and I have been in conversations for the better part of a year now about what was going to happen. Insurance, of course, is always scary. Renewals are always scary. It's one of the most important things we have for our employees. As you all know, salary-wise, Parke County is not very high on the scale of salaries. So all we can do is offer the best and most stable benefits that we can. Health insurance, of course, is one of those things. And so we had some struggles the last couple of years. We did make a change. We always make change to the health insurance very reluctantly because it's so disruptive, or can be so disruptive for our employees. I think the changeover with you guys and with Anthem, going back to Anthem, was a smooth transition, and for the most part it's helped. In every case, whenever you change pharmaceuticals, whenever you change any of that stuff, there's going to be some people who are going to benefit from it, some people are going to be damaged by it, and you try to ameliorate all those that you can. So we really I expected probably an increase somewhere in that 12-15% range with inflation as it is. Our claims were extraordinarily high this last year, and over that we have no control. Just so you know also, I feel like I'm preaching to the crowd, or to the chorus here, but just so some folks will know, Parke County is self-insured. We have been self-insured for several years. And the reason that is, just real quickly so you understand what we're going to be talking about today, if we are fully insured, we go to, say, Anthem. And Anthem is willing to cover us, our insurance. We have to pay them so much money in the pot. And so let's say that we, through these underwriters, so I don't know how they do their job, but they do their job. They have some reasonable expectation of what our claims levels are going to be for the next year based upon all of our demographics, everything about us. And so we can fund that expected claim. Expected is where the underwriters think that's probably where you're going to come in, how many people are going to have so much money. You can fund higher than that or you can fund lower than that. But the insurance company is the one on the hook for the claims. That being said, that the insurance company is on the hook for the claims, they're always going to charge you more than they expect you to get because they don't even like really to be like 75% utilization. They want less than that because they get to keep whatever's left over. If you've thrown $2 million in the pot and you only have $1 million worth of claims that year, then that insurance company gets to keep that $1 million. Self-insured, as we don't do that anymore. We don't go that way anymore. We still have to hire a third-party administrator to do our claims, so we get the benefit of their platform or their discounts. They've negotiated discounts with the various hospitals and entities. R.E. Sutton has negotiated some wonderful things with different entities, Hendricks County Hospital, for example, which we have no access to do those kind of things. But that is all we hire. All we hire now is someone to adjudicate our claims, make sure they fit within the scope of the policies, and that the claim is good and clean, and then they send the bill to Parke County. Parke County pays that claim. That way we actually only pay what our actual claims really are. We fund at a level where we think between the employees and the county we'll have enough money in the pot to cover those. If not, we simply have to come up with more money to pay those. We buy insurance to cover high costs, high dollar claims. We've had 3 this year. A really high, maybe $250,000 claims. We buy insurance to cover those should that exist. That is one case where if we bought this reinsurance, it's called, and then we don't have any high claims, then they get to keep that money, but that's just like you buying car insurance. If you don't have a wreck, you've just given all that money to your insurance company, but you were covered, so you knew what that risk was that you were sharing. You were going into a pool to share that risk with everybody in that pool. So I expected that to be high because they have had to pay, I don't know how many dollars, you probably know, but how many dollars that reinsurance company has had to give back to us. If we had over, I think it's 50,000 singles, and I'm not sure what the $1 million is on aggregate, but if we go above that level, they pay those claims. And so we will get reimbursed some dollars by, this year, several, I think hundreds of thousands of dollars from the reinsurance company to because it's done its job. We reached those high claims. The insurance company had to kick in. They will reimburse us the money that we had to put out. So it's worked out pretty well. Knowing that, that's a long story. I'm trying to make it short right here. Knowing that we're self-insured, the real important part for us today is to make sure that we negotiate with these folks in Brown Insurance and then our TPA Anthem to get a cost for fixed costs. Beyond that, the claims, that's just whatever the claims are. And so we have to decide how much of an increase in our funds do we have to have coming in. What's going to be the increase for the employees? What's going to be the increase for the general fund to make sure we have enough money in the pot to cover those expected costs. And then if it's more than that, we'll have to come up with the money. If it's less than that, then the county didn't have to pay out that money. So that's where we are. Long story short, Nick, that's where we are. So Nick has been working on this, and he's got some good news for us today.
Thank you, gentlemen. Yep. To your point, let's just take the stop loss as an example, real world. You guys have paid in about $330,000 in stop loss in the past 12 months. You've received back about $550,000. So it's been a good bet for you. The carriers have actually taken the brunt of that risk, and you've gotten to pay out about $200,000. So it's worked out well. Let's go ahead and talk about the claims, give you guys an update on where the claims are running before we get into the final stop loss. So on page 1, you guys are going to see this is our rolling 12 report that gives you an update on how claims are operating. So we're going to start in the bottom left corner where you see the yellow and the greens.
A rolling 12 is from this date back 12 months. So every week that changes. So we can see where we are now compared to the
This is us looking at the past 24 months of claim activity and comparing our current 12 to our last 12. So in the bottom left corner under our enrollment, you've seen enrollment has not changed much. It's down by about 2%. Nothing to be concerned with there. That kind of jumps every month a little bit. As we move over 2 more columns, you're going to see your medical paid claims. In this current rolling 12 period, you see about 1.8 million. In our prior 12, about 925,000. So we've had about 108% jump in our claims. Like Jim was mentioning, not something that we can necessarily control. What we can do is put programs in like that Hendricks Regional Hospital to take orthopedic surgeries, get them at a much better price. Programs like RX Protect that are saving people money on their drugs. Those are 2 important things. But on the medical piece, 108%. You can see our claims we've had a number of high-cost claimants. Moving over to our pharmacy piece, our pharmacy costs have actually been controlled really well, under 4%. Trend on pharmacy is about 13% right now, so we're far under trend. The RX Protect program has actually provided already in 3 months about $31,000 in savings. Great. So we are really trending in the right direction on RX Protect, and that's also saving members. They don't have to pay anything out of their pockets. Move over to the EPH, the other eligible claims. This is about $8,000 a year. All it is money you guys are paying to Anthem or UMR in a case to make sure you're healthy. Your unhealthy people are kept healthier. So when a physician notices someone with a high risk score, they pay more attention to them. They get them in there more often, try to schedule more meetings, and then they get a little bit of an update or an increase there. Not very much money. The next column is the important one, claims over the specific. You guys can see in the current 12-month period you have had $553,000. That is money coming back to you. Everything else we looked at was money coming out of your account you're paying for. This is money coming back to you every time someone has a claim over that $75,000 threshold. You guys get money back. So whenever we see money in this column, that's a good sign technically because we're getting money back on high-cost claimants, but that impacts our stop-loss renewal the next year. Right, because we're getting the risk protection, and we've been cashing in. We've gotten over $200,000. What I think you'll be happy with what we have based on that number right there. Moving over 1 more column, you can see our claims are up 76% over the prior 12-month period. The final column goes back to what Jim kind of was talking about. Underwriters anticipate a level at 100%. So here's where we think you will be this year, and we recommend you fund there. You guys are operating at about 166% over where underwriters anticipated. So we've had a number of high-cost claimants, a few different things that have gone on that were not anticipated. In that prior 12-month period, we're running at 90. So we're running a little bit hotter. But again, the claims are the claims. And I think when we look at our next page, page 2, has our fixed costs. So this is the important piece that Jim was talking about. When we take a look at our Anthem, our blue columns here, you see our Anthem current. Column number 1 has our Anthem offer originally. If you go to the very bottom, that's about a 7.6% increase in your fixed costs. That's what they came out with initially. So if you go up a little bit, you see there's a 12.9% and a 12.5%. Those are for your spec deductibles or your insurance that we were talking about, that belly button insurance for all of your members. Let's move over to that next column, column number 2. This is what we were able to negotiate with Anthem on your behalf. We went back and forth with case management notes. We went to the nurses that were taking care of a lot of these members. We said, where do they stand? Where can we get to? When we had that conversation with Anthem, we were able to get down to 7.5% on our spec and 5%. Average stop loss increase is about 15% right now, and that's with groups operating at about an 80% loss ratio. We're up much higher than that. We're up over 100%. For us to negotiate this to about a 7.5 on the spec and then a 5% on the aggregate, it's a really good win, we think. It's a great offer. 2.9% increase in your total fixed costs. If you guys wanted to stay with Anthem, make no plan changes, everything would remain the same. Deductibles out of pocket, your network, all of that is the exact same. At the end of the day, we went to 10 different markets because we wanted to make sure we got the best deal. Of the 10 different markets, we're really only showing you 3 right now. So we took Anthem and went to a captive solution. A captive is when you would go in with other counties, other like-minded companies, and say, if we get in on risk together, what does that look like for us? When we went to the captive, number 3 here, you can see actual rate hold almost on your specific and then a reduction on your ag, negative 0.2% in your captive. So that's an option for us. I don't know if that's our best option now because we got a good option with Anthem. The hold or the snag on number 3, if we go down to our second from the bottom, you will see there's a buy-in for that captive. So there's a $50,000 collateral to get into that captive. Getting into that captive really gives you a lock-in on your stop-loss rates in the future. I think we can take advantage of that in the future if we need to. I think the Anthem offer right now is good enough that we may not need to. Just sharing what I talked with Richard about on numerous occasions. Number 4 is us taking a look at what you guys used to be doing, right? You had UHC, you had their network. We actually improved the pharmacy vendor, so your pharmacies would be through TrueScripts. And with that, we came with about a negative 12% on the fixed costs. But it's important to note there's a little bit of stickiness. You need to re-enroll. We've got to do new business paperwork. New ID cards have to get out. So that would be a little bit more of a process at the end of the day.
And also that savings between UMR and Anthem will probably be covered by the fact that Anthem has higher discounts on the claims that they have. So the higher discounts themselves will probably pay for that difference.
Yeah, correct. We've gone through this a number of times with a lot of different markets. Anthem has the best discounts for you guys here. We went to Anthem and UHC. We also went to another carrier called PBA. They're more of a boutique vendor, so they do business strictly here in Indiana. Networks like PHP, Union Hospital, things like that. At the end of the day, they quoted it, they looked at it. It's not really competitive. So we could go with a more local Indiana solution, but we're going to end up paying for it a little bit more on the back end, 4 to 6% at the end of the day.
Just so you know what discounts he's talking about is that Anthem is so large they have negotiated with different hospitals and different entities that we will send all of our people to you if you will charge this amount. So that's the discount. Since they have so many more people under their umbrella as some of the other carriers, they can get better discounts because the hospitals want them to bring their people to them.
Yep. So at the end of the day, option number 2 is the revised Anthem offer. We think it's a good offer if you guys would like and are happy with what you have. 2.9% increase on fixed costs coming in under 3%. Any questions on that before I move forward?
You guys have anything? Nope. Sure.
And then we wanted to bring some other solutions too. So we've got the captive if we need it in the future, and if we ever want to go back to UMR, we have some options. If we want to go back to UMR now, we could, but just be a little bit of a change for the members. That's member facing.
And one of the worst things that entities like us, small entities like us, who really are insignificant in the eyes of the big boys, is if you change it very often. You don't want to go to market any more than you have to because they have no confidence. So for us to stay another year with Anthem, see how that falls out. To have a 2.9% increase, even the 6.6% increase on the renewal there, in an atmosphere where inflation is at 8%, that's not even counting medical. Typically, medical inflation is twice what regular inflation is. So I think that's a pretty good offer there.
And just to share a little bit more, we actually had some additional claims come through in September that will make this offer look even better at the end of the day. We had to negotiate with them not to change this offer based on claims that recently came through. So the fact that we even beat them down harder to make sure we stayed where we are in number 2 because we had some things come through in September and early October. Okay? Any questions on page 2 before we move on? I want to be respectful of your time. Page 3 is your dental. nothing changes. If you guys like what you have, we can keep it for another year. No change in network, no change in price, nothing at all. We didn't, Vision is not on here because it's not renewing, it's in a rate hold. So nothing changes, it's a 2-year contract, we're going in the 2nd year of that contract, okay? Page 4 gives us our considerations and our overall health costs. So if we start at the top, our annual premium that we're generating this year is $1.4 million. So we're funding our account $1.4 million. Since we're running at 160%, we're running pretty high. We're anticipated to spend about 1.5, so we're up and over. The stop loss reimbursements are helping us because we get that money back. When we go down to our 3rd highlighted line here, our expected liability for next year, so it goes from about 1.4 to about 1.7. So the actual expected liability goes up around 11, 12%, where we recommend our groups fund to. And then page 5 is our ultimate recommendation from Richard and myself and our team. Somewhere in the 4 or 5% range is what we think is prudent to make sure that we're making progress towards funding our account. The claims are the claims. We got a great outcome on the fixed cost. I just think we need to continue to fund the account a little bit better. Like Jim said, if you're fully insured, you're giving them all the money and then they keep the money. Here, when we have the money, if we don't spend it, we get to keep it. So I think 4 or 5% is fair without taking on too much of a burden.
And if you look at that up there on the page 4, it shows that if we fund at a level of what shortfall we're looking at, and if we fund at that level, if we fund it at 3 or 4%, I think we were talking maybe $190,000, $198,000 shortfall if we were to reach expected. Typically, we don't reach expected levels. We always could. In fact, this year we're above, so we could, but we don't expect to. So we have enough in reserve because the reserve is that we have funded at a certain level, but only spent at this level. Instead of Anthony keeping it, we keep it. So we have enough now in reserves to cover that shortfall should we experience that higher than expected claim.
And part of every stop loss market is taking a look at your risk for next year, and a lot of our stop loss markets felt good about the risk, so I think we have reason for optimism that our claims are going to be cleaning up here as we move forward. They're not going to continue to be as hot as they are right now.
Okay.
And any questions on page 5? At our ultimate recommendation on the 4, the 5% is probably where I think you guys should be if you can take that. The rest of the stuff is just reporting, so I'm not going to spend any time with it. It's just showing you what Anthem provides from a reporting sense. Some of the drugs that are on there. If you guys want to go through it, you let me know. And then page 9 and 10 are just a refresher for the Hendricks Regional Program that you guys are offering to your employees. We've already had one person complete that program, and then we've got a second that's in the process of working on getting the surgery.
Just so you know how that works with Hendricks, one of our people that were covered went through that plan. Instead of just filing a claim, by going through this program that Sutton has negotiated with Hendricks County, we send them to Hendricks County, and not only does it not cost the employee anything, but in this case, for this operation, this surgery, the employee actually gets a $1,500 stipend. So if they're going to have a knee replacement or a hip replacement and they go to Hendricks County to get that done, they'll have no out-of-pocket costs for that procedure because the savings by going to Hendricks versus going to some other entity is significant enough that not only does it save us money, but we can incent the employee to go there to have that surgery, which they're not required to, but they could, because we offer them $1,500 then up front to cover whatever they want to cover in their medical costs. So not only does it not cost them anything out of pocket, they will actually get a check from us for $1,500 to go there. Obviously showing that we save much more than that $1,500 by having them go there, but we share that savings then.
Correct. And just to give another quick perspective on it, when we're talking about pricing, like hospital pricing is all over the board, right? Some are much more cost effective than others. How do we know the hospital costs? We use CMS, which is the Centers for Medicaid Reimbursement level. Indiana's average reimbursement for like a knee surgery is like 310% of Medicare reimbursement levels. So if it's a $10,000 knee surgery, the average cost is, or CMS would pay $10,000, the average person or the plan, your guys' plan would pay $31,000, right? 310%. The Hendricks, you guys lock in at 180. So your knee surgeries at 10, not at 31, you lock in at 18,000. So instead of $31,000 for knee surgery, you lock in at $18,000. Spine is an even bigger one because spine's like 400% of Medicare. So instead of paying 400% of Medicare, you get it at 200% of Medicare. So we can save $100,000, $200,000 on a spinal fusion just by having go through the plan.
And I'm sure you don't know, but if you don't know, used to be Ortho-Indy was the place to go, but now Hendricks County is the place really to go on the recommendations of every significant company that does those kind of studies.
Yes, there's a major study called the RAND study that comes out every 3 years, and it does price and quality and it compares the two. It's a huge study. Ortho-Indy and Hendricks are right at the top together on best outcome, best surgery, best physicians, and also best price because they have they're doing it so often, they know what they're doing. You know, they do it more efficiently is the easy way to say it. But that's it from our end.
Okay.
Ultimately, the recommendation for it, if you guys are interested in the Anthem offer, we think it's fair. We think it's a good one. And then we've got some other options to look at if you'd like to.
I think this is me thinking now, so what you guys think? I think we should vote to take the fixed cost thing with Anthem. The 2.9% would be my recommendation to stay where we are. But then we may choose to leave it up with the council to decide because they're the ones doing the money. Parke County years ago was a dinosaur in the insurance world. County paid 90% of the cost, employees paid 10%. There is no place that does 90-10 anymore. Typically it's 80-20, where the county pays 80% of the premiums and employees pay 20%. Most corporations are now 75-25, so several years ago we began the walk to try to get to 80-20, but we just didn't want to throw all that to the employees in a year, so we've taken it over a 10-year period. Every year we add a percent to the employee side of the ledger, and then the county has a percent less. Right now we are at, the county's paying 86%, employees paying 14% of the premium cost. This next year it will be 17% being paid by the employees and 83% being paid. So we've marched from 84.16 down to 83.17. So there'll be a 1% increase just on that for the employees, and then we have to decide how much of this 3, 4, or 5% we want to add to that. So if we want to go to 5%, knowing the employees are going to get a 1% increase anyway, we want to keep it at 5%, then we need to go with the 4% increase to get that to go to 5%. That makes sense? Kind of a long story there. So, I don't know if we want to choose one. We could certainly make a recommendation. We could certainly give the okay. We can vote on going with the Anthem offer, and then we can decide where we want, because really that funding level is up to us, where we want to fund it.
Real quick, the second renewal, it's firm, but there's not a deadline. I just want to make sure we enter a deadline for that second renewal. The other ones are like 11/11, which is this Friday.
Yeah, we probably want to give them an answer this week.
Okay.
Yep.
Again, that's where I just.
Yep, this week is what we need to do for an answer.
So if you don't have any other questions, then I think I would make the motion that we go with the Anthem revised renewal at
Number 2.
Yeah, number 2.
Yep.
Is that your second?
Yeah, I'll second that thing.
Okay, it's been moved and seconded to go with number 2 on the renewal list here with the Anthem renewal revised at 2.9%. All in favor say aye.
Aye.
Opposed? Okay, there we are.
Thank you.
And then we'll decide amongst the council and us on what percent.
And thank you very much, gentlemen. I appreciate it. We've got an exhibit for your team on the 86-14 split,
Okay,
changing
great.
to the 83-17.
Okay,
So I'll
great.
leave that with your team.
Great.
If you have questions, you can just get in touch with me.
That's just you guys need their new rates.
Just
Figure with new
for
rates.
whenever it does get decided, you'll have those available.
Okay. Thanks.
Thank you very much.
Man, your sidekick didn't do anything today, was he? Having that-
told me.
He's
Go
our
up
new
there.
he's our new underwriter.
Oh,
He's
really?
learning Caleb's role, so he wanted to be part of a meeting, so I wanted to make sure we got
Well, I'm
him.
glad you came. What's Caleb doing?
He's in Hawaii with his wife.
Oh man, tough for him. I hate that.
Yeah.
Okay.
Isn't that kind of crazy?
Tell him I said hi begrudgingly, but tell him I said hi. Yeah.
Thank you, guys.
Thanks, guys. I appreciate it. And really good work. Don't feel you have to stay, but you certainly can. But it gets less
appreciate
interesting
it.
from here. Yeah. Thank you very much. Tell Richard I said hi, please.
I sure will.
Okay. Justin here. Yeah. Hang on a second, Justin. See if we got anything else first. Otterman Church. Ask about the courthouse lawn. Anybody hear from that? Remember the details from that? When they want to use it?
Oh, I don't remember when.
Do we have a letter from them or
There
anything?
should have been, there's an ordinance here.
It says request to use courthouse lawn
No,
to
that's
place a
the traffic.
nativity scene. Church was granted permission in 2021.
What's the date they want for?
Probably Christmas time.
Okay.
Nativity scene.
Oh, yeah, that's what
Remember
that was. They
yeah,
put the nativity
they put-
scene in.
Yeah,
Yes,
that was that wood one,
yes.
that
Yeah.
nice wood one that they put up
Yeah.
there. But I don't know how long they want it there.
I don't know either.
Whether it be a week or
There isn't anything, I don't even remember how long it was last time.
last year, I don't remember. It was there for a while.
It was, yeah.
But I don't remember.
Yeah, I think we'd be okay with approving it. We just work out the details and what that.
It just says to be put up and taken down in a timely manner,
Yeah.
so.
You okay with it?
I'll make
Yeah,
a
I'm
mo-
fine.
Is that your motion?
Yeah, I'll make a motion, we allow the Otterburn Church to use the courthouse lawn for their nativity scene as they have in the past.
I'll second that.
All in favor, say aye.
Aye.
Okay. I bought them spotlights last year for it, solar ones. There's no electric over there. We couldn't run electric over the sidewalk. It was trip through it, so I bought them. I bought them, solar lights for them. Okay. We have before us a request to look at on the ordinance for the semi-traffic. Justin, you were talking about that? Why don't you come on up? We'll get all your stuff done. We talk about that while you're up here. We'll get that all taken care of at the same time.
That's what Jason had called me
Yeah.
on.
What this is about is that it was a looking at trying to control truck traffic going through Mecca, of course, with the temporary runaround for the next 3 weeks probably, while the state is closed, Snake Holler, working on that culvert. So it's something just brought to us to look at, and it says a total weight of greater than 10 tons on the prescribed roads, and it's talking here about the Coxville Road and roads in Mecca, but I just don't know that we can do that without some justification of that the road can handle it. I don't know that we can control. It's a public road, so I don't know that we can control telling who can and who can't use that road, as long as they're not in violation of any weight limits. We don't have any weight limits on there now, so I don't know that I'd be comfortable. What are you guys thinking? What are your thoughts?
Well, to start with, I guess you've got, where do you draw the line? I know the semis should not be going through there. I mean,
And the highway department
That's-
has signs out that says no semis, but
yeah,
I think it's a minimum.
their route should be across 36 to 63 and back around. I would think that would be more apt to be something we'd have to take up with the state. I mean, they have an official detour and unofficial. The unofficial is for local traffic only. It's not really for those semis. But what you would consider a farmer with a semi, a guy that's logging, you got Mecca Junkyard right down there that fills semi-trailer scrap and hauls it up to Nucor. It's kind of hard to tell them to go ahead and do it and then stop all the others. But the others really should be stopped. But I would think that would, have you tried getting hold of state?
No.
See what their opinion is on it?
For those that might not know, traffic through Snake Holler is closed from Coxville Road, where the turnoff is there to go to Mecca or go to Riverton Park. And then it comes out to Rockville Road on the north side of Mecca, up there by the New Harmony Church. And so the official runaround is to use 63, go to Montezuma, come back 36. As Dan said, anytime there's an official detour, there is an unofficial detour, which the state will take responsibility. If there's any damage to their road, then they would repair it once we had a claim for that. But as far as telling people what roads they can and can't use if they're public roads, I think we'd be hard pressed to be able to justify in a court why we told some trucks they could use the road and some trucks they can't use the road, why some people can and some people can't. We do have signs out by the highway saying no semis, hoping that the other semis will take the official detour. But I don't know that we have any authority unless we declare a road weight limit, as we have to in spring sometimes. I don't know that we can just tell semis they can't go through there. Mecca may be able to tell them, Incorporated Town may be able to tell them they can't Because Marshall does that. Marshall doesn't want somebody going on the Marshall Road through town, because we tried to use that for a truck route to get them off of 275 and whatever that one by Gene Jones is. That
450.
450? Yeah.
The town of Mecca would be the one that'd be more apt to be able to get stopped, because we've got 4 roads leading into Mecca, but
I don't
we
know.
have
We
no
can tell them they can't use the
jurisdiction.
county road. Yeah, I think so.
Yeah.
And I can mention that to him. I wasn't sure what the legality of it was, but
I think I would contact the state, because if Mecca, one of them was in here and asked us before they actually shut the highway down a few months back, what to do about it, and I told them they need to contact the state, because they would be under the same rules we are, as far as if it gets tore up,
The state would pay
the
for
state
that.
would have to pay for their road too, so.
And we understand, I understand completely the inconvenience of all of a sudden having all that traffic, whether you live in Mecca or whether you live on Slavens Road, when they had to close that.
Yeah, I was gonna say that this is not the first time.
Happens every time.
And it's not gonna be the last time.
When
We're gonna
traffic was
have
directed-
unofficial detours,
Yes.
But
every project. Was there, and maybe there's something going, is there specific things that people are concerned about, or is it just in general, the people in Mecca don't like the extra traffic, or?
what they're telling us is just like there's one bus stop at the main intersection at the 4-way.
Yeah.
So we're worried about the kids, and then the speeding is what we're hearing.
Early on, there was a school service officer who was there at that stop when they stopped it. Did they discontinue
On the
that?
very first day we had done that.
Just that one day? Okay.
Yeah.
and I guess if they're speeding, you guys can give them a ticket for
Yeah.
that.
And we've had guys when we can try to
Yeah,
go
it's-
through.
A lot of roads to cover.
Well, I think you've done good. You've got the speed indicator signs coming into town, so they know how fast they're going. They know what the speed limit is. If they make that choice to violate that, I don't know how you stop that unless you're there to stop and do that. But I know we had this issue. I had friends contact me when they went through Coloma for that month or so. They were just sure somebody was going to die, and thankfully they did not. But it's always going to be an inconvenience. Merrill Getchy was stressed on Slavens Road when Daly Hill was being worked on for all that time. Because you get all that traffic. You know, you live out in the country on a quiet road. You don't want all this traffic. I understand that. But I don't know how we can pick and choose who can use the road and who can't use the road. Unless there's a weight limit on it.
Well, if it's a bridge, it's
Yes,
easy,
exactly.
it's
Weight
easy
limit.
to stop,
Yeah.
because they're tested, the state and federal forces is
But-
testing them, but load limits on.
Both of those, and I've checked, both of those, the concrete bridge and the concrete abutment, both of those are open ranges, so there is no weight limit on those, so. I understand the concern, but I don't know what we could do about it.
Okay.
I guess
Well,
I'd contact the state.
it's worth a shot checking into, so.
Yeah.
The,
I don't know what the state could do about it, really, now.
well, it is an unofficial detour, I mean, and it reads, when you bid a contract on an unofficial detour, it reads that it is for local traffic and heavy traffic emergency vehicles.
Well, that'd be good. Maybe the state can do that, then, so.
The state may be able to do something about it.
Is Tom still the president of Mecca Town Board?
Yes, I think so. Tom
He's
Ford.
on it, but I don't know if he's the president or
I
not.
thought he
I'm not
was still
sure.
president.
He'd be, he works at ACE, he might be out there to talk to him and see if they could do it. That'd be great if that was a way to go. I just don't think we have a way to control it. Totally can't do it.
They no longer have a town cop.
No.
Mecca, I didn't think they did.
Well, as long as we got you up here, what else you got for us today? So you don't have to come back.
Just basically, so far we've generated 143,428 for DOC, and then we started picking up Sullivan County inmates. They've gotten a mess and they're remodeling. Ended up with a lot more inmates than they'd anticipated,
Really?
and so we agreed to hold some of theirs. We've been doing that since September. Anywhere from, I think we're down to 7 today, but we've housed, I think, 15 at one time, so.
Are they expanding their jail or just renovating? I thought they were.
Yeah.
I talked to the mayor some time ago.
And the reservoir, the boilers at the jail, we had a meeting this morning. Concerned on the amount of time that we may be without hot water, but it sounds like we worked through that and they've come up with some different solutions on how to shorten that. So, but that did start today. So, And it may be like a 2-week
Okay.
process to get that done, so.
Okay. So what do they do in the meantime? I know Matt was concerned about how they get their hot water, how they get their showers, and
We talked to a few people, and I think basically as long as we don't go 4 days or more without it, then we're
Okay.
okay. So
Great.
what they're looking at, there may be like a 2-day shutdown without hot water,
okay,
and then they can turn it back on for a couple days and then
Gotcha.
do it again.
Good.
But
okay,
not all the inmates will take a shower, but
right,
we have to give them the opportunity
Okay, sure.
to. So
okay,
yeah, it should be okay now. So.
okay. All the furnaces in now, all 7 for the resident? They got 5 for sure. They're working on the
Five
other
or 2 more. So.
Okay. So those projects.
And they're
are
both in
moving
the like over the bathroom. It's a
Okay,
tight area, so that's what
gotcha,
the issue. I think you can get 2 workers up there, and that's about it. So.
gotcha, okay. Bridge Festival peaceful?
Yeah, I mean, probably the first year I remember in a long time we didn't have anything super major.
Great,
Maybe 35 people got arrested in 10 days, maybe, and I mean that's not a high number. So I mean it's a little above average. So
did we have one fatality in a car accident?
no.
Okay. I thought
That was
there one.
outside the county.
Oh, was it?
It was,
It was on
Oh, in
36.
Putnam County.
Putnam County,
Morton,
okay.
around Morton or
Yeah.
something
Okay.
like that.
Okay.
Yeah, I was gonna say. I mean, it was pretty good for us.
How did the 4-way stop at Belmore work out?
I don't think we had any major accidents there, but I don't. A lot of complaining. I don't just being backed up on weekends mainly.
Yeah. But it will be anyway, so.
But the state police was out there on the weekends. But I don't. Unless we have to go through there, we try to bypass that area just so we don't get bogged down in it. But from what I was reading and hearing, I mean, I don't think they were out in the intersection very much.
Good.
I think they were just kind of letting
Good.
the 4-way stop do the work. So.
Was the feds here with any
No,
knockoff?
nope.
Or none of that?
No, and I actually didn't see any. I was looking
That's what I wondered too.
for, and I didn't see a single thing. So
Good. Okay. How many days you got left?
I didn't start counting since I'm still kind of sticking around. But
I was gonna say you're not going anywhere.
yeah,
Okay.
kind of looking forward to it, I guess. So.
Well, I think we've been well served. I think you've done well, so I appreciate you.
Thank you.
For just an old turkey run boy, you did okay. So. Anything else for us?
I don't think so. We should be good on the Union Hospital
Yes.
details. So
Yeah. Justin will talk to them again. We're finding things still that need to come out of the county. Got to pay pension, got to pay the retirement, got to pay all those extra things. But the hospital has agreed to reimburse us for all those expenses. So the idea all along has been that it wouldn't cost the county anything. It'd be an opportunity for our officers to make some extra money. But of course, our council didn't want to pay anything to provide security for the hospital. That makes sense. And so what they're working on now is the county won't have to pay any money to the officers to go work for the union. Union's going to cover all those costs. It sounds like now. So
they'll cover the county's portion,
yeah,
pension, Social Security, and Medicare.
Yeah.
So
all those extra things that come out of the checks, we'll go ahead and run them through the county, and they'll deduct those, but we'll get reimbursed for those.
yeah, and on the voucher they'll have it at the bottom what the county actually takes out of that
Okay.
to keep for the county. So.
Okay.
So it should be fairly
And how long
easy.
will this go on? Ongoing thing?
Basically, yeah, indefinitely.
Okay.
So
Okay.
they're just trying to go 24/7 with security, and
Okay.
where they didn't before, so
Right.
they kind of farmed out to us. And
Well, that'll get easier as it
Some other-
goes, and you'll figure it out more. You won't be running away, you're going upstairs, but yeah, I understand. Okay.
so,
Thanks, sir. Appreciate it.
well, thank you.
All right. John, you got something for us today? Or are you just here visiting today?
No, I think I was supposed to come and present on Thrive.
Okay.
If that's okay.
Yep.
On the resilience study. Let me take one and pass it down for me. Well, thank you, Commissioners. My name's John Ford. I'm the Director of Business Development for Thrive West Central.
Don't you have some other little job too?
I've got a side hustle.
Yeah, okay.
That's what we call it.
Okay.
Well, Thrive, we've spent the last few years during COVID and coming out of COVID doing a deep dive, creating a study called Resilient. And Resilient was designed to identify and inform West Central communities of the most pressing needs. And what we really did was try to take a deep dive into things that would help our communities go after grant money, know what directions to go in. So we've created this, the study's well over 100 pages, but we've created kind of a summary flip book with some of the major points. But I just wanted to touch on a few tonight. I don't want to belabor this. One of the areas we looked at obviously was population, because that's drives a lot of things. Parke County had what is one of the few counties with growth in the population. That was reported in 2021 through the census. Within that data, we find that the aging population is around 18%, with projections to continue to increase to over 21% going forward. So you may ask, why is that important? Well, as we think about our communities and growing, it's really important to develop strategies to let people age in place, because obviously more of our community is going to be in that aging demographic. So, finding ways, finding services so they can stay here in Parke County and age. So we will, continue to look at that. Per capita, again, another very important statistic that we reviewed. Parke County's per capita income reported in 2020 was a little over $41,000, about $10,000 less than the state average, and about $18,000 less than the national per capita. So when we, the per capita income is extremely important because it's what drives education funding, housing. When we think about housing, we want to make sure that we're building the right type of housing that people can afford in this community. A couple other areas that I'll point out. The poverty rating for Parke County was better than most in West Central Indiana at 15%. State average is 16%, and our regional average is over 18%. So some good positive news. Unemployment tends to be about 2 points lower than the state average in Parke County overall. Let's see, transportation on page 17 was something interesting for us. We found during the survey that about just a little less than 7% of households in West Central Indiana do not own at least one car. So, as we heard earlier, healthcare is extremely important. So, as we think of almost 7% of our population doesn't have access to a vehicle, how are they getting healthcare? How are they getting basic needs? So, that is why that statistic we found kind of was really interesting. We were not expecting that. Substance abuse on page 19. When we look at statistics of when kids are taken away or removed from homes in Parke County, it's almost always tied to some type of drug abuse by the parents. And then I'll leave with one last stat, housing, and this was kind of a number that has probably changed a little bit since our study came out. But in West Central Indiana, the median price home is $122,000, which is almost a $38,000 increase from January of 2020. So that's how quickly our housing market changed here in West Central Indiana. And it's probably come down a little bit with mortgage rates going up and recent changes in the market. But there's tons of stats in this flip book and other information. And, we're always at Thrive open to discussions and any questions you might have. Happy to answer some now, but also you can feel free to reach out to us and we'll be happy to answer questions.
I think it's good information
I
to
think
have.
this
See
is
what
great.
it is.
I'll look through it.
Yeah.
The only thing we jumped to Ryan about was on the front page, that picture, the Vermilion County's got our bridge on Vermilion County's picture there, so.
I'm supposed to say it was taken from the Vermilion County side.
Yeah, okay, we'll go with that. That's funny. That really is good stuff, and you guys have done good work with that, and I'm proud to be associated with that board. I think it's good information. They've done the housing study, we've done a housing study, trying to see where we are. We're in the midst now of trying to do a preliminary engineering report as far as bringing the sewage from the northern part of the county, take care of Bloomingdale, Marshall, Trigger Run, and Trigger Run School. So that's just in the very beginning, looking at getting a PER done for those. So there's lots of things going on. We know about the internet, making big moves on the internet. So we're getting there, slowly but surely, but we're trying to do it right as we go.
Oh, great. And one last thing I might say is that Wednesday we're having a housing workshop, Housing 101 workshop. We're bringing in someone from Ball State who's working in the Fort Wayne region and Lake County region to do a workshop on.
What time is that?
It's 10 o'clock at the Historical Society
Okay.
there in Terre Haute.
And if you didn't know, Ball State just put out a study showed that Parke County was in the top 10 of rural counties in the state that are primed and ready to go and expect a significant increase in remote businesses coming in, which means we really need to enhance our broadband as we are. So things are happening for us. It's just keep plugging along. Thanks, John.
Great.
Appreciate
Well,
it.
thank you very much, Commissioners.
Thanks, John. Appreciate it.
Okay, what else we got? Anyone else? Oh, Randy. Come on up, Randy.
How you doing this evening?
We're good. How are you?
All right. First thing, I have a couple of bridge inspection claims. Need your signature on, Jim.
Okay, you just pass them around. You don't have to walk around.
Okay. See, $68,159.07 for one, and $2,500 for the other one.
How far along are we on our bridge inspections are going like you want them to, I guess, where I'm.
Yeah. Uh-huh. Yeah, we're gonna have to be advertising probably about February or so for
Okay.
the next cycle. Thank you. And along with bridge inspections, I've got another, it's an amendment to our contract, and it's due to having to revise load ratings for the HL 93 design inventory. It's not very much, only $6,556. That's so they're gonna have to put new signs up, as we did, what, 3 years ago?
Yeah.
And big signs. Well, they're coming down.
Really?
Yeah, and we've got, I forget how many it was, 300 and some signs ordered, cost of $8,000 to $10,000. To put along beside our regular weight limit signs on the bridge. And this will be the new EV
For the emergency vehicles.
emergency vehicles. And you got to have the distance from the intersection to the bridge.
You may have seen along our country roads now, there's a big sign showing the weight for emergency vehicles to go across bridges, which is significantly different than the rated weights of the bridges. That's to tell the first responders what weight limit this bridge can stand on a one-time use thing, not a daily use, but on a one-time thing. So it may be double the weight, or better even, of a bridge. So if a bridge can stand, emergency vehicle to go across at 20 tons, but really it's only rated at 10 tons. That's what that's for, because it's a one-time use going across, not a daily use going across. All of us sign this.
So these signs have to change because they changed the restrictions on some of the bridges, or does all of them?
No, just
Just because
They
of the
changed the sign.
location and,
They changed the signs more or less.
okay,
All right,
at our expense.
But they had to, well, yeah, but
I'd make a
this will
motion
be
that,
shared.
that we adopt amendment number 1 for the LPE consulting contract to amend and supplement the original contract in the amount of $6,556 to meet the sign requirements.
And I'll second that.
All in favor, say aye.
Right.
So the state amended what they wanted on the signs then, basically, for the
Yeah.
bridge inspection.
I forget how much was spent on those big signs.
So it didn't matter that it was us
No.
3 years ago.
Yeah.
If they want to change, they want to change.
I argued, I said, well, you guys ought to pay for this change.
Yeah, that's what they said. The
But
state-
that didn't work.
Silly you, silly you.
Mega Ridge looks good. That looks good, and I appreciate you splitting that with the CVC, and appreciate the CVC. I have been down and looked at several requests. I have not proposed it to the CVC, so I can't promise on their behalf. But are you interested in doing the same type of deal with Thorpe Ford Bridge? Because Thorpe Ford really needs that site
Yeah.
too.
Yeah,
Okay,
it
if we get
does.
them to split it, you're okay with splitting that with us again, if we can do that next year?
It does.
I don't know
Needed.
it does, I don't know if CBC will approve, but I think they will, because we tried to spend a few thousand out of our budget each year and do some improvements to what we have, so.
Okay,
Okay.
yeah.
All right. And I think your folks are getting an estimate on
I
that?
think Luke is working on this.
Okay.
But
And
you have more, or before you leave, I had a question for you too.
okay, yeah, go ahead. I got some more, but
Surveying road right of way, who do you normally use for that?
Myers, was Myers.
Yeah, it's
Engineering.
Myers sold out, I think.
I can't think of what they're called now. But,
Dave Myers is still working, but he's working for
oh,
somebody
he's in
else?
Texas.
Oh, he is?
He moved
Okay.
out with his family.
Okay.
Do we have any states, is there any right of way down at Bridgeton where we had that all redone when the bridge was built? I know there was paperwork all done for the right of way. Do you know anything about
don't
whether it was
remember.
actually surveyed or? I remember you renewed, Jim was in on renewing the paperwork. for
Mike
it.
may have,
To
Mike
ver-
Rowe may have paid for that, because he was
But
one.
I don't think there was ever a survey,
Oh, okay.
that I remember.
I'd ask.
I remember the wording on the road right of way was renewed, so somebody couldn't claim it was theirs.
I'd ask Mike and see where that
But
is.
where I'm going with this, what I'm thinking about, there's a bottleneck down there when people come in on the dead end road to the bridge where it's blocked off. Where you've got some rocks set
Rocks
up and
and
a
there's blocks.
guard.
Oh,
If-
on the north side.
When
Yeah,
you're
the
coming
north
in
side.
on the north side and you dead end there.
Uh-huh.
Okay, that gets real close to the county road, Bridgeton Road that we use. There's a narrow strip there.
Uh-huh.
I don't know if that whole strip's ours, if those two right-of-ways connect. What my theory is, to solve that problem, right where them two roads almost come together, if we put a pipe, well, you've got rock sitting in there, white rock to keep people from driving through there now. What would happen if we connected them two roads so there was no longer a bottleneck there? During the Bridge Festival, and I discussed this with Justin, what happens is when they're parking cars on both sides down in there, then they don't allow anybody to get in there. If somebody does get in there, then they're stuck. Then the deputies have to go over and try to stop traffic and get somebody backed all the way out. And that's why I wondered if that does belong to us, if we could put a pipe in there where we put rocks to keep people from driving through the dirt and connect them two roads that little short distance. But I assume we'll have to have a survey done before we actually
Well, that or
hook the two roads together.
it may say in the bridge plans too. I mean,
Okay, and it might.
if that property was donated to the county,
I think on the north side, there are 3 owners of that little section.
CK's,
4? Oh, okay,
Yeah.
I knew 3.
But what I'm getting at though is, that's only, it's not even near the length of this room. So I'm almost wondering if our road right of ways at that point don't
Cover
come
that,
together.
yeah.
So we could actually put a pipe in there and hook it together so there's no longer a bottleneck there. If someone gets in there, they can at least get out. give it some thought, and
Okay,
when I know you got a lot on your plate, but if you
Yeah.
get time between now and the next 6 months,
okay,
figure out if we do own it or not.
okay. I know we lost a lot on the south side.
We lost almost everything.
Yeah.
They closed the road.
Yeah.
If we're not careful, the same thing's gonna happen on the north side.
Uh-huh.
They're already using it to their own advantage, put money in their own pocket, so something has to be done. So. All right, that's all I have.
Okay. And I have a claim for Milestone. This is for paving New Discovery. The state calls it New Discovery, but it's our Ferndale Road. About $122,331.18.
I hear they got 720 done.
720's done, and 1,000 is done with a second lay from 720 up on top of the hill before you get to the first house.
Is that ended? Are they done now then with our?
No, they're gonna finish it tomorrow.
Okay.
They didn't work on it today because the Amish had a lot of
Okay.
trucks deliveries today.
Is that the last one then for the community crossings for this year? Good. Okay.
Just want to see this.
No, right.
It's an out-of-cycle check. I'll just make a motion, we approve this out-of-cycle check to Milestone for $122,331.18.
I'll second that.
All fair side.
Aye.
And you had asked us to do a speed limit
Mhm.
for Coxville Road from 41 up to Mecca city limits.
If you weren't aware how that works, Coxville Road is south of Mecca to 41. Mecca Road is from Mecca north to 41. There is a speed limit going north at 35 mile an hour, but there is no speed limit south. So I thought one of the things we might be able to do to at least help with the traffic on the county road out there would be get a speed limit on that. So that's what this was.
Yeah, it's, the said section road is 1.255 mile long, and putting it down to 35 mile an hour.
And that'd be the same as on the north side. Yeah. So I'd make, we have a number, ordinance number.
Yes, 14.
All right, I'd make a motion, and that we adopt ordinance number 2022-14, establishing a 35 mile an hour speed limit on Coxville Road from Mecca to 41.
And I'll second that.
All in favor, say aye.
Aye.
I'd make a motion that we adopt this same day, same meeting.
I'll second that.
All in favor, say aye.
Aye.
Okay. See that? See, I told you you could read. I knew you could. You look a little tired today. You worn out?
And there's
I'm alright.
same day, same meeting ordinance on the back of it.
Speaking of stop signs, was there ever a stop sign put up over there where we had discussed that in the ordinance where evidently two people was fighting about it, Rosedale Road and road that goes to,
Yeah, it seems like we,
well, I assumed you probably did, but if they did, somebody swiped it again. I don't even know what you do, we just take the portable welder and weld the bolts on the back side so they can't get it off. It's, I don't know, I don't understand people.
well, I'll check and see what the ordinance says for it now, and see if we,
Or holler at me when you're done and do
That
it.
way they got it tested.
Oh, I'm sorry. Who puts up the sign?
Tommy Truax.
I was gonna say, if I'm around, I can take a portable welder out there and weld the back side so they can't get it off.
What else you got?
But that's all I have.
Okay.
Need to get her signature on this.
My
Unless you got-
signature?
No,
Yours, okay.
that should be attested.
Okay.
But that's all I have, I think. Unless you guys have anything else for me.
It's pretty good weather.
If Lou gives you or gives us an estimate on that, just so we can approve something, if I get CPC to approve it, is that something we want to look at doing in the winter? Signing, is that a good time, bad time? What works best for you guys?
To be honest with you, I'm not exactly for sure where the sketches are.
Okay.
I'm trying to go the other way.
I understand.
Stay out of it.
There's a second page, Dave,
Okay,
that
I
you need to
missed it.
sign on both of those.
Oh, we're back to
I
page
will.
one.
I do know he has quite a bit going. He's bid 2 or 3
Well, good.
NDOT jobs. It's probably gonna be one of them things that he can probably, thank you, Randy, need them now?
Did you sign both of them? Should have been back page
Second
on the second
page
one
on that
too.
second one too.
I'll say, I'll just have him make connection with you. That's
That'd be
probably
perfect.
the best route to,
Be perfect. We just need to plan on budget where the money comes from, whether yours or ours, either one, where we're gonna, if we have a water bill cost. I'm guessing be the same, about the same cost, probably.
Yeah, I don't have-
Single span bridge
Yeah, I
across
don't
there,
know.
so. Okay,
I know he's measured all. I know he went that
Okay,
far.
great.
He went out there and measured all the
Great.
thing, but whether he's actually made connections to find out
Okay.
prices on siding, that sort of
Okay.
thing.
And I think they said we ought to have plans for the Melcher Bridge in a couple of weeks.
great. Got asked about that again the other day. All right, thanks,
All
sir.
righty, thank you.
Appreciate it.
You guys have a good evening.
Have a good evening, Randy.
Anyone else have anything? Yes, sir.
I just, I'm now here, not, I often come here right before I need something. I'm here 6 months ahead of time. We're talking about the events for Billy Creek next year, and we're talking about closing Billy Creek Road and what we need to do that. We're holding a big Civil War Days
Yep.
in early May, probably 300, 200, looks like 200 plus Civil War reenactors will be out.
Yep.
And so,
We can give you a consensus on that. We wouldn't be able to approve it until we get specific, but we
Right.
talked email the other day, and what they're talking about is, as we've done in the past when Civil War Days, where they're close Spunky Point across the bridge. It's an inconvenience for very few people because they go out the highway around it anyway. So, would the consensus be to tell them to go ahead and plan on doing that, plan on having that done? Then when you get specific dates, bring and we can approve that.
I guess my opinion is I have no problem, but I want to be straightforward exactly what we're doing, when we're doing it,
Yes.
so we don't run into the same issue we did
yes.
out on 36.
Yes.
Right.
So,
Right.
yeah, I don't have a problem with it.
Okay. Would you want specific dates today?
No,
No, we don't have to have that. I'm just saying
because
ahead of time.
things may change for you too.
What's the time frame?
If we had-
or two before?
If we had a 30 days, 30, 45 days ahead of time, so people can plan on that, they know, so no surprises for them, but it's really not gonna impact much, because they'll be able to get up. Now, are you wanting to close Spunky Point all the way from 36, or you wanna close it just where it goes across Billy Creek there, and still go up the hill?
Yeah, there is a gate on, by the livery barn there that we can shut,
Yep.
close, and that.
They could still use that road,
Still go up
come down the
the
hill and round out the highway
Yes,
if they wanted to.
exactly,
Yeah.
that would be one, and there was a gate on Billy Creek
On the
Bridge, and it's no longer there. The posts, the screw post things
Right.
are still there, but the.
Right.
the
That you would need to make sure you get permission to do, because we have an ordinance against making any change, alteration to the
Right.
bridges, but we can do that, as long as they know it's gonna come off in a timely
Yes.
manner, so we can work that
Or
out.
we could just do it with the sawhorse also. I mean, that
Yeah.
would be the.
Yeah, whatever works.
Okay, so.
Yeah. I'd say give us 30 days, 45 days notice, and but just so you know, we've agreed that we'll approve that, so long as we get specifics on it, and that you can plan on that.
I just want to introduce you, Michelle Mondoshi is my new manager out of Billy Creek.
Nice to meet you, good luck out there.
Pleasure to meet everybody.
Yep.
You too.
And if you got some questions, I'm sorry, go ahead.
Oh, I just think as much as anything, so you have to put newspaper, people's aware of it, the locals, and know it's gonna be closed for X amount of days from such and more AM till PM, and
So put a notice in the.
no, I'm saying that's why we
Oh.
wanna know ahead of time.
We'll do
so-
all that after
so
our
the
meeting.
gals at the newspaper can put it in,
Okay.
so.
Newspaper does a pretty good job. They're kind of
Yeah.
slow, but they do.
Thanks.
She's a good one, I tell you. So if you talk to Jessica about anything you have planned like that, she'll take care of getting all the word out there. She does a great job. We're lucky to have a newspaper like that in a little town like this. We're fortunate for that. If you've got any questions, anything I help you with on Maple Syrup, let me know. I'll be glad to help that.
I appreciate it.
I didn't put the original in. I know they changed that when years ago. Those actually weren't maple syrup pans. Those were actually sorghum pans, because they're flat bottom pans rather than flute pans. But you don't have to have flute pans, but I don't know what shape those are in, if you need to replace
They're
those.
pretty rough.
Yeah, so if you want to replace those, I'd be glad to look at that before you do that, because there's a whole raft of options out there, and typically those pans are pretty expensive, so you don't want to get the wrong thing, so I'll be glad to help you with that.
I appreciate it.
And I have a couple suppliers that you can go to and talk about getting the stuff too, so.
Fantastic. Thank you.
It's not near as complicated a process as it looks like it is. If it was, I couldn't do it, so we're in good hands, so we're okay.
Okay.
There's one other quick thing about the bridges. The Rotary Club has volunteers to paint the inside of the bridges. Is that correct, or is that?
That's news to me.
That's actually, I do a lot of those, but that's actually the Interact group of Rotary works with it. And the Convention Visitors Commission provides the paint and the equipment to do those. So typically what we do, if right before Bridge Festival, they go out and do those. They can't do them earlier because they just get written over again, so you got to do time and manner. But typically, and we've done this with a couple people, if they want to adopt those kinds of things, we would provide the paint and the rollers that you could take care of that yourself. If you have something come up overnight, you want off of there because you have people every day.
Right, that's what I was.
That we can provide. That won't be a problem. You just let me know what you need, and we'll make sure that you get a gallon of that. We use a solid stain rather than paint because paint peels off.
Yes.
Solid stain won't peel off, and so and we're doing them all the same color. It's a clay color. It's less standout, less in your face kind of thing.
So,
I appreciate when people go out and try to cover that stuff, but we get pinks and purples and red, whatever they happen to have to cover the stuff up with. So it makes sense to have some kind of standard paint to use on that. So we can get that to you.
okay, and but that was only for the Billy Creek Bridge after the Leatherwood
Right.
or
Right.
the.
Yeah.
Okay, got it.
And just so you know, I mean, we're still interested, as we talked about before, of having those bridges. So the other two, give them back to the county.
Yes.
We would take care of that. Beeson is just awful shape, but we would take care of that. And when I talked with Charlie Cooper before, he wanted us to do that, and it's just, Charlie, we can't spend tax dollars money on that bridge. It's your bridge, but if you give it back with some promise that they can stay where they are,
Stay there.
then we'll take care of those. We'll maintain those. So it'd be one less thing you have to deal with.
I'll definitely talk to you about that.
Yeah,
I'll plan here.
we can get that worked out. That was, well, yeah, we talked about that, but it was a process done years and years ago when entities were different, and people were different, and it just turned out well for a while, and then it kind of fell apart. So
Absolutely.
yeah, we can fix that.
Yeah.
I don't anticipate any needs that you have run across, because we're so excited about the fact that you're doing those places, getting life back to them. I can't imagine anything coming up that if we have some role that needs to be done, that we can legally do, I can't imagine anything that we wouldn't help you with to get accomplished. We want to see that be successful too.
All right. Appreciate it.
Yeah. All right.
I missed the Civil War days.
Yeah.
We're going to be excited about that.
That was huge. That was
May
huge.
6th and 7th is
People are
what
gonna
we
be
are
excited
booked.
about.
Great.
We already have a confirmed company on both sides.
Great.
And we're having 2 confirmed demonstrators already. We've got food vendors lining up. So
It was huge.
it's growing faster than I could have ever imagined it would.
When it fell apart, the Civil War reenactors fought amongst themselves over who the general was going to be, and they couldn't get along over who was going to be the big dog that week. So that's how it fell apart.
Okay.
So one side said, well, if he's going to be the general, then we're just not coming. Well, if you're not coming, then we're not going to go. And
It seems like everybody's excited to just come back. So things
they are, and the
seem calmer.
people. I have friends who do that reenacting. They don't care about that crap. They couldn't care less who that general was. We want to go do this stuff, you know. I have friends who had a cannon, and they love taking that around. I had them come out to high school, to give demonstrations of cannons going off, and they couldn't care less about that. It was the people in charge that territorial power stuff.
Eli Grimes is our event coordinator for this. He is part of the 44th Tennessee Company. And this is actually his first event to plan. So he reached out to me about a month or 2 ago saying, hey, I want to do this.
It's exciting.
He's in contact with quite a few of the older gentlemen that previously organized. And so he's got the right information, and he's very excited as well.
It was the biggest one in Indiana. You know, they get pretty big. There's a lot of people in that kind of stuff. And it's pretty exciting stuff.
Yeah, threshing and harvesting days too out there, didn't they, at one time?
Used to. Have you thought about that? There was a big steam.
Yes,
brought a big
steam harvest
engine.
days.
Yeah.
I have, basically this past week or so, I've been going through the 40 plus years of paperwork that is upstairs in the general store, and I have pulled pretty much all of the event information, the ones that seemed reoccurring and even some of the smaller events, so
Great.
that we can kind of see how they did it, what it was about,
Great.
for the possibility of bringing those back. We are focusing very hard on not biting off more than we can chew faster than we can chew
I understand.
it. So we're really trying to just focus on a couple of new events each year.
A good resource for you to give you information. He certainly won't tell you how to do. Well, maybe even, but he won't. But Doug Whiteside was a manager for years,
Okay.
and Doug Whiteside, love him or hate him, there is no better promoter of Parke County and Parke County things than Doug. So sometimes he will work wonders. Sometimes he will irritate the heck out of you. So you just have to see what he's doing. But he would be a wealth of knowledge for you on what they did, not how you should do it, but what they did, maybe who they talked to, and that kind of thing. He's a good guy, and
Okay.
he'd be more than willing to help you get back.
I'll absolutely.
That's as important to him as anything, that this gets life back to it again. All of us who are on the board hate to see that die. So whatever we can do to get it going back again, let us know.
Yeah, we're very excited. We have a volunteer day for leaf cleanup this Saturday on the 12th.
Great,
From
great.
10 to 4.
great.
Bring a rake if you can.
All right. You buy anything else? Nope.